స్టార్ట్ చేయలేదు.
చేసిన yeah. Thank you. Hello, good afternoon. So my topic for today is Poshan Abhiyan, which is one of the part of the nutrition thing. So my topic for today is Poshan Abhiyan. So this is the outline of it. It is under the wing of Ministry of Women and Child Development. So as we see this, we can see the world map where it shows like 151 million children are stunted. Under 5 children are stunted across the world. And when you see more than 30% contribution is from low middle income countries, lower middle income countries like India, we have Pakistan around, and we have the African continent. So when you see this, you should understand the burden of the under 5 children who are stunted, and they might be so chronically malnourished that they have landed into stunting. So this is from a Global Nutrition Report 2018. So this slide shows you how undernutrition will manifest and have its impact. So the basic problem is undernutrition. When you see that the basic problem is undernutrition, what can be the manifestations of undernutrition? It can result in micronutrient deficiencies, will have wasting, the child will be small for gestational age, they might be having suboptimal breastfeeding, and then again chronically malnourished childs are stunted. What are the consequences? So when it is not just a personal problem, right? Everything has consequences and that impacts the economy. So consequences are under 5 and maternal deaths, which keep increasing. There'll be impaired physical and cognitive development in a child because of undernutrition. Then there'll be decreased economic productivity. There'll be compromised health of the adult. See, an adult who was undernourished since childhood, how would he grow out to be? He will have a compromised health. He will have a low IQ comparatively. The chances of him flourishing in the life, the all changes when your physical health is compromised. And there are high risk of intergenerational perpetuation. What do you mean by intergenerational perpetuation? See, when you talk about undernourishment in a child, when a child is undernourished and he grows out to be an adolescent who is undernourished, take an example of a girl who was born preterm, who had low birth weight and was undernourished, neglected, grows out to be an adolescent, gets married, goes into pregnancy at an early age. With malnourishment, there'll be anemia, she's pregnant, she'll be anemic, carrying a child. That child may come out to be anemic again. So, see, it goes on for generations and generations. So, somewhere you have to break the chain. So what is the impact? Impact is 45% of the under 5 mortality is contributed by us. There is 22% of adult income loss. The IQ loss, like 5 to 11 points by stunting. There is low IQ, like 5 to 11 points lesser than compared to the normal counterparts. And there is annual GDP loss of 11%. So when you see this, every rupee invested in nutrition gives a return of 34 rupees in India. So mind you, we all together need to invest in nutrition, right? See, investment in nutrition during the first 1,000 days specifically, but not cutting the edge at 1000. It can continue, but investments in nutrition during the first 1000 days build human capital and boost the shared prosperity. So at the time of schooling, there should be early nutrition programs that can increase the school completion by 1 year. Then early nutrition programs can raise the adult wages by 5 to 50%. And children who escape the stunting are 33% more likely to escape poverty as adults. There'll be reduction in stunting can increase the GDP by 4 to 11%. The source is Shekhar et al. This is an investment framework for nutrition 2016. So see, it starts from the first day one. If you concentrate, your life will be different, and even the life of the nation. So, Poshan Abhiyan, this is our topic for today. It was launched on 8th March 2018 under the Government of India had approved the setting of Poshan Abhiyan with a 3-year budget of 9,046 crore commencing from 2017-18 year. The focus is on the first 1000 days of the child and preventive care for adults and girls, women, and mothers. It also aims to reduce stunting, which is 38.4% to 25% by the year 2022. What are the targets of this Poshan Abhiyan? The targets are to prevent and reduce the stunting in children aged 0 to 6 years at 2% per annum. So, for the target is total reduction up to 6% minimum at the rate of 2% per annum. Prevent and reduce undernutrition, underweight prevalence in children 0 to 6 years again at 2% per annum. Reduce low birth weight at 2% per annum. Reduce the prevalence of anemia among young children 6 to 59 months at 3% per annum. So we want to reduce in the 3 years for 9%. Reduce the prevalence of anemia among women and adults and girls in the age group of 15 to 49 years at 3% per annum. Here also it is 9% on the whole. It can be more. So, Poshan Abhiyan implementation, it it was started in 36 states and union territories with 719 districts. There were 7,075 projects, 51,328 sectors, 1.4 million field functionaries. You know there are what all are field functionaries. Then 100 million beneficiaries. So, what are the components of Poshan Abhiyan? Poshan Abhiyan basically wants convergence of at every level at the national, state, district, mandal, block, every level there should be convergence. So, what are the components? The first component is convergence. I'm sorry. There should be convergence. And then there is ICDS CAS. What is ICDS CAS? You know what is ICDS? CAS Convergence Application Software. Okay. And then there are behavioral changes through IEC, Information, Education, Communication, Advocacies, Jan Andolan. This should be taken not as a personal work of one individual or one sector. It should be a Jan Andolan. It should be taken up by everyone, community, individual, everyone. And it is a task for everyone to, you know, decrease the percentage of anemics we have, especially children, mothers, and adolescents, because they are the future generations. And to provide incentives to the mother, to the pregnant lady through these schemes, there should be new innovations. There should be training and capacity building. Okay, and there should be a call center for grievance redressal. So these are the components of Poshan Abhiyan which are very important. The four pillars of Poshan Abhiyan is technology, that every field functionary is enabled with technology to easily transfer the data, easily get the data, store the data, and so that it is easy to understand what is going on at the ground level. Convergence is at all the levels. You start from national level convergence of all the ministries. It is not just the work of health ministry or just women and child development. It should, the stakeholders should be from all the ministries, all the departments, public, private, and there should be public private intersectoral coordination too. And we should be teaching behavioral change communication here. So you give them advocacy, you try to make them learn and help them to change their behavior, to think what is going on, and then maybe they might change their behavior and change what is going on. So this is a very important part. And capacity building, training and retraining of all the field functionaries who are involved and at all the levels to understand about this program and to understand about all the other programs and to integrate them together so that the beneficiaries get the actual benefit. Technology, so CAS is common application software, I'm sorry. So it starts with an Anganwadi app. So data entry will start at the ground level. Then there'll be first level supervision by a lady supervisor. Then there'll be multi-layer supervision. Okay, and then there'll be an administrative dashboard where we can examine everything. And this data will be collected in real time, offline, online. It is multilingual. There'll be GPS tagging for every place. There are multimedia tools, visuals, clips, IC materials, BCC material, and there is a call center for help for grievance redress. So, what is this common application software? It is Reach. It is been helping 1.79 crore beneficiaries, 1,81,378 Anganwadis, and 107 districts. Convergence, as I said, converge at all the levels: national, state, district, block, village, everywhere. So you start Niti Aayog. Niti Aayog is what is formulating all the advisories. So we should have convergence in all this levels. See, these are all important. When you take Department of School Education and Literacy HRD, why is it important? Yeah, these are the places where kids study. So when we have nutrition planning programs over there, then these people have to get involved. Then information and broadcasting is very important for people to understand what are the schemes going on, what is the importance of it to enroll in it. So information and broadcasting is a main part. Then tribal affairs, drinking water and sanitation. Obviously safe water is very important. Health and family welfare is already dealing with it. Women and child development, urban development, rural development, consumer affair, food and public distribution, Panchayat Raj, and Niti Aayog. So, what is the mechanism of convergence? So, National Council for Nutrition, they is established. So, they have timely meetings which are being held. So, there have been 4 meetings held till now. Last meeting was on Feb 12, 2019, and they have already published 2 reports up till now. So, after National Council for Nutrition, there is an executive committee which has already had 5 meetings, and then we have state convergence plan, district convergence plan, block convergence plan, and converge village health and sanitation nutrition day at the village level. So, states and districts are oriented a number of times, and conversion action plan guidelines were released on 2nd November 2018. Nutrition based converged meeting to be held at state, district, and block level every quarter. What is conversion action plan, CAP? So at national level, national counseling reports to the PMO every 6 months, meets every quarterly. State executive committees headed by the secretary, Ministry of Women and Child Development, meets every 6 weeks. Then, State Convergence Plan, chaired by the Chief Secretary, Convergence Action Plan, finalized by the end of the Jan, is submitted to the Ministry of Women and Child Development. And at the district level, it is chaired by the collector, which finalized by 31st December for the consequent year, and they meet quarterly. Block convergence plan, as chaired by the SDM, finalized by 15th December for the consequent year. And at the village level, it is a village health, sanitation, nutrition day. Okay, so this is how there should be meetings. So how is it implemented? So there is formulation of annual convergence action plan. So they have to formulate about the infrastructure, how should be the infrastructure, how will be the services delivered, who are the resources, who are the functionaries, who are the beneficiaries, then what are the interventions required in this program, which is the supply chain, the behavioral change, how will it come, what are the materials to be supplied, how do we have to do it, and then after doing everything you have to monitor. So there should be quarterly cap meetings at the block level, then at the district level, and then at the state level. And they have to use this common application software dashboard. And there should be formulation of cap committees at all the levels. And this convergence is multi-sectoral. See, they should be promoting a safe drinking water. So it involves the municipal board, it involves the water board, water supply. Then promoting sanitation, stopping the outdoor defecation, and then it is very important part. And then promoting personal hygiene, hand wash facilities should be provided, hand washing with soap. So across the multi-sectoral convergence across should be across the households, anganwadi centers, health centers, schools. So everywhere these have to be followed, promoting safe drinking water, promoting sanitation and personal hygiene. What is the monitoring mechanism? So see, if you are implementing something, you will want to monitor to know the outcome. So monitoring mechanisms are antenatal checkups, institutional deliveries, breastfeeding, complementary feeding, growth monitoring and promotion, management of acute malnutrition, and anemia. So, breastfeeding, when you come to breastfeeding, how do you monitor? You have to start that within 1 hour of delivery. It should be continued till 6 months. Complementary feeding should be initiated at 6 months of age. Then growth monitoring and promotion. Children from the age group of 0 to 6 years are being monitored by the growth charts at the Anganwadi centers. So there should be monitoring of the weight and height. And management of acute malnutrition, severely acute malnutrition, and moderately acute malnutrition children. And anemia should be looked out and managed in children, adults, and girls and mothers. Then service delivery and intervention. See, these are all the services which have to be delivered, like vitamin A supplementation, iron and folic acid, calcium supplementation, immunization, deworming, diarrhea management, food fortification. So vitamin A supplementation, as we already know, it is given to children from the age group of 6 months to 59 months. Okay, iron and folic acid supplementations are given in all the age groups from children 6 to 59 months, adults and girls, women of the reproductive age, pregnant women, lactating mothers. Calcium supplements are to be given to pregnant women, 360 tablets they have specified. Immunization to the children till the age of 1 year. So in 1 year we cover all the 7 vaccine preventable diseases. So immunization till the age of 1 year is called as fully immunized child. Deworming. Children aged 1 to 19 years. It is done, as you all know, National Deworming Day is held on uh, in February and August every year. And diarrhea management in early initiation of oral rehydration therapy, zinc supplementation. So this is how you should manage. And food fortification actions to be taken at state and district level. What is behavior change and Jan Andolan? It is at all the levels: center, state, district, block, and village. So, what are the platforms? So, there are transmedia campaigns. So, you have Village Health Sanitation and Nutrition Day, which is held monthly. Okay. Then nutrition assemblies, nukkad nataks, festivals, specific days like Yoga Day, Breastfeeding Month, Poshan Ma. So these were all held, like Breastfeeding Month is August first week. So National Yoga Day is being held. So these are all the platforms where behavior change and can be applied. So at the Ministry of Health and Family Welfare, there is National Health Mission, Janani Suraksha Yojana, home based care of the newborn, and home based care of the young child. Then Anemia Mukt Bharat is one of the schemes where they are targeting this intergenerational perpetuation of the anemia, and they are trying to cover the anemia, decrease the anemia. And Mission Indradhanush, where we are vaccinating kids. It's an speed up program. And then at the rural development, we have National Rural Employment Guarantee Scheme, and then there is National Rural Livelihood Mission, and again, women and child development. This falls under women and child development. Poshan Abhiyan, Anganwadi services, PM Matru Vandana Yojana, scheme for adults and girls, and then there is housing and urban affairs, Swachh Bharat Urban, Anganwadi centers, PM Awas Yojana, toilets and waters. And then at the Panchayat Raj, there is mobilization of Gram Panchayats, up, uh, giving them toilets and water, village health sanitation and nutrition day. Then there is Swachh Bharat Mission, Gramin Swachh Bharat Mission, safe drinking water and washed toilets. Then HR, that is Human Resource Development. So, human resource development is involved in midday meal scheme, unified district information system for education. Then, information and broadcasting, it is involved in behavior change, Jan Andolan, song and drama division. Consumer affairs and food and public distribution, food fortification, public distribution system. Renewable energy, like solar energy, and tribal affairs, special requirements in tribal areas. So, Ministry of Minority Affairs, requirements of minority communities, Angan, in case of if there are any gaps. So, now aligning the functionaries. So, inclusive of Anganwadi workers, lady supervisors, ASHA, ANMs, SBPs, there are 24 lakhs. And per day, and the NRLM is 47 lakhs. And the Swachh Grahis are 4 lakhs. Capacity building. So, what are the themes? Maternal nutrition, newborn care, breastfeeding, complementary feeding, management of undernourished child. So, what are the platforms? These are the themes for capacity building. What are the platforms? State, district, block, and resource group. It is integrated learning approach. E-integrated learning approach, ILA. So this is how these platforms are to be used to build up the capacity of the trainees. Then there is Swachh Bharat Preraks. Swachh Bharat Prerak is a Ministry of organization with Tata Trust have the Swachh Bharat Prerak to be deployed across each district. Total of 323 SBPs will be deployed. Those are Swachh Bharat Preraks will be deployed. So in all the states, when you see there are already SBPs which are deployed, which help and prerna is like motivating them to understand all these things and to keep themselves clean, keep the environment clean, and come out of all these problems. Key action points. So what are the key action points? They should be conduction of regular quarterly meetings of this common application program. There should be monitoring of the dashboard. There should be update on the ICDCS. There should be monitoring of Anganwadi centers by surprise visits. They should ensure delivery of 6 Anganwadi services, that is supplementary nutrition, preschool non-formal education, nutrition and health education, immunization, health checkup and referral services. These are very important, and it has to be ensured that these 6 services are delivered to the beneficiaries. So this is a model Anganwadi center. There it was refurbished. So refurbishment of Anganwadi centers, like whatever minor civil work repairs, the concept painting on the wall, facility of safe drinking water, provision of electrical connection, availability of basic furniture, IC material, preschool education kit, and a small playground. This is the basic of every Anganwadi center. Thank you.